I started with atrial fibrillation, and it gradually got worse until my family practice doctor sent me for a heart cath. And at that time, it was determined that I was having problems with my heart and that I should see a cardiologist. So he therefore sent me to our foremost one here in Lake Charles, and we started with a heart cath there. And he determined that I needed surgery for the aortic valve replacement. And I asked him if maybe I had another alternative to surgery, and he said, oh yes, sudden death. I was doing well until I went to my cardiologist meeting again, and he tells me that I have developed a leakage in my tricuspid valve. And so we were just going to watch it for a while, that it at that time was not extreme, so we were going to watch it. And we did that for a year or so. And then last year he suggested that I see someone here in Houston that he referred me to. That way we would, see what could be done. But at the time, the procedure was to do it through the veins, because there was not a procedure perfected to replace that valve. So we would see about putting a clip on the valve. And so I asked if there were complications, what was the backup? And he said, well, there was a procedure to replace the valve, but it was exploratory. It was first, and that he had done 4 of those. Well, that caused concern. I didn't know that I cared to be the 5th. So I asked and got a second opinion. I was miraculously referred to Dr. Kassi, who agreed to see me. And we came the same day. And I didn't know it at the time, but that was her day off, and she came in just to take care of me. So that was great. Anyway, we really enjoyed her visit, and she explained that she would much prefer going the medicine route and trying to adjust medicines before going to procedures. And that appealed to me. I was diagnosed with breast cancer, and of course there were tests that were sent to California and came back. And so when the surgeon called me and told me that my tests were positive, the first thing I asked him was, how soon could we do a mastectomy? And so it happened that the following month I had a left breast mastectomy, and I had 8 chemotherapy sessions, and I had 32 radiation therapy sessions. The last pregnancy I had at age 41. Well, the birth was at 41, age 41. So at that time, I can remember that the obstetrician was checking me and had a regular appointment. I think it was about maybe 3 or 4 weeks before I was due when he discovered that I had, my blood pressure was awfully high. So he sent me directly to the hospital from his office and did a C-section. So thank God everything turned out okay. And she was a beautiful child. And I've been on high blood pressure medication since that time. Doing regular household chores and cooking and cleaning and things like that got to be a problem because I didn't have the energy to do it. And I would have dizzy spells. And I didn't have good balance. And so it bothered me that I could not do my normal work. Dr. Kassi increased my Lasix to 80 milligrams a day, which for me was terrific. The results were that I lived in the bathroom and until my body had adjusted to that. But she didn't change medications immediately, and I was glad that she took her time and measured what she wanted to do. She added Entresto, and she also added Eliquis, which were 2 medications I'd not had before. And so I think with those medications, it just made such a difference. And I began to get my energy back, and just the ability to do things. I'm able to get back out in the yard and I do some clippings and rakings and tending to things. I do all of my household chores. I do cooking, normal family living. So it's really been great. I've enjoyed the grandchildren and, done things. And we had Thanksgiving at my house. Great. We were over 30 of us. It was great. So those things I really enjoy.